Welcome back to the show. Today's guest is a doctor that went from the bedside to the C-suite and now sets out to make national impact. His group is responsible for about half the kidneys in San Antonio. Please welcome Dr. Hamid Mizani.
Thank you. Thank you for inviting me.
Yeah, I'm glad you're here and you were able to make out the time to be here.
Sure. It's beautiful to go. Just telling you earlier.
Yeah.
Watching myself creating a practice, 20 plus years ago,
Yeah.
and then seeing you, what you've done is incredible, right? You've taken it to another level.
I love it. Thank you. And I'm glad you're here. You're part of this. I want to know about your journey. So tell me where things started, what got you interested in medicine, and how did you land in San Antonio?
So I'm originally from Iran. I was born in Tehran, and when I was 12 years old, do you recall 1980s? There was a war going on in the Middle East, and it's happening now. My dad wanted to, give me another opportunity in life, and sort of spoke to my brother who was living in the U.S. at the time, and found my way to basically make it toward U.S.
Okay.
The journey was like a typical immigrant journey.
Yeah.
Turkey, Spain, and ended up in Dominican Republic, of all places, which is a beautiful country.
Yeah.
And I actually deeply feel that I'm Dominican and Hispanic. I lived there for 11 years.
Yeah.
So I did my middle school, high school, and also university there.
Okay.
From there, I came to University of Miami, and the journey of American medicine began.
That's awesome. That's phenomenal. So, got into medicine. Like immigrant families, there's a huge focus on doing medicine or engineering. They only recognize these careers, nothing else.
Right.
Was that a personal decision, or was it sort of influenced by family?
Both.
Okay.
Persian families, you're either a doctor, engineer, lawyer, and now IT.
Oh yeah.
Used
Now
to be a
it's picking
mechanic. When I was
Yeah.
I watched my grandma going through cancer, and that was really impactful, and how we had to deal with that. And my father basically, he was a firefighter by training at the time, and he couldn't help. So I thought, what a beautiful field to be in and be able to heal people and families. So
love it.
got in it, and be honest with you, I couldn't do anything else.
Yeah.
So-
No, that's phenomenal. So you get in, you do internal medicine. What makes you choose nephrology?
As I was doing internal medicine, I interacted with a lot of different professors and ICU care and outpatient care.
For sure.
Nephrology was the field that really connected all the dots. I really loved pathophysiology and learning about the diseases and how they interacted with each other. The specialty that really would use that knowledge, in my opinion, was either endocrinology, rheumatology, or nephrology. And then I had this professor, this is in Rochester, where I did my internal medicine residency, that just made me fall in love with the field and never look back.
That's phenomenal. Yeah. So you come in, you do your fellowship, and then you start your program afterwards. You started your own group. You don't get trained to do that in residency. You don't get trained to do that in med school. What made you decide to do your own group?
I wish I could sit here and tell you I had this grandiose idea and I was born with this superb intelligence. No, it was just by chance.
Okay.
So I studied nephrology fellowship here in San Antonio, UT San Antonio, incredible program, back in 2001. And again, great professors. And as I was doing the fellowship, almost finishing, I was looking for a job.
Yeah.
There was no job available for me.
Oh boy.
There were other groups in town that wouldn't hire me for some reason. They just didn't have a position. And my wife had 1 year left in dental school. Mm-hmm. So what do? I say, well, let me see if I can open an office.
Yeah. So you started your own practice like that.
And my wife goes, you know nothing about opening an office. I'm like, I know. But let's see what it looks like. So I go out there and look for a loan and look for a space.
Wow.
And meanwhile, I'm a second-year fellow.
Oh, yeah.
Doing nephrology. I remember when I was in the transplant ICU, I was designing what an office should look like. And a year later, when I did open the office, I realized it didn't have a lounge where people should have a place to sit and eat. No, I had a reception. We didn't have a lounge for the staff.
I see.
It was it's trial and error, right?
Yeah,
a lot of falling down and getting up.
Yep.
So no real previous business degree, and it was all medical.
Yeah.
But the passion was there, right? I really wanted to care for patients.
Love it.
And it started in August of 2004. the practice. And I remember walking into the emergency room, first patient, with my, ID that was still wet from a picture that had been taken, just like 2 minutes ago. And the ER doctor asked me, "You want to help me with these patients?"
Yeah.
Happened to be a potassium of 7, extremely ill patient, kidney failure, respiratory failure, really, really sick. And I did. And it worked out well.
Yeah.
So that ER doctor would look for me.
Oh, yeah.
And after a month later, he asked me, "What group do you work with?"
Oh, yeah.
And I said, "My name." And he goes, "But I know, but what group do you work with?" I said, "My name."
Yeah. Yeah.
He goes to tell you, my company didn't have a name. It was my name itself.
Yep. No, love it. That's phenomenal. So, a lot of falling and getting back up. And now we go like 21 years past, right? And now you've got a group with over 20 physicians. Like I said, your impact has gone beyond you. It's gone to other physician extenders. It's, you're covering a lot of real estate at this point with patients and their care. I'm sure it's not an easy road, right? And it takes a special person to be able to accommodate 20 physicians, 20 providers, because physicians come with their own set of challenges.
Yeah.
How did that all happen?
Is there a secret formula or sauce for this? No. I think part of it is your personality, being flexible, understanding people, understanding situation. It's like a chess game as well. You have to understand what action leads to what consequence.
Yeah.
So also you have to have very thick skin, because it is not easy to try to create a practice in a very competitive city. But my focus has always been do right by the patient.
Yeah, good care.
Good care, it's priceless, and build a relationship with the patient and the family. And one patient becomes 2, and then 4, and then 10, and then 20. That's never changed. I still practice nephrology full time.
Yeah.
So you see me in this gear. This was not by trying to look nice. I had to run from the dialysis unit that is about 40 miles away from here to see you, and it was really sitting next to a patient, looking into their eyes, listening what the problem is, coming up with a solution, and then next and next. And I think that has been the basis of the practice. So patient care is the center of what we do. Yeah. No matter 1 doctor or 20 doctors or 30 doctors, doesn't matter. And that really goes about the culture that you build in a medical practice, right? Absolutely. So it's never been about finances. Finances are important to be there because they pay the bills. Yeah. But it's always been about patients. And I think now as a practice becomes more complex, you have to train yourself in the understanding of the language of the business, right? To know what the finances are, how do you work with different banks and, mortgages and loans, and how do you pay your bills and all. So that is there. But even now, as I interview new doctors joining the practice, actually I give lectures of medical economics. Last week was in Dallas. Talked to about 80 doctors about what it takes to create a practice, right? And the exact questions you're asking me, they're asking me in a panel. Yeah. And the first thing is your passion, and also investing in yourself, believing in yourself, but knowing you're going to fall. And no matter how you do things right, you will fall. Yeah. But you need to know that you're going to get up. Yeah. And tomorrow's a different day. So you also have to create an environment where other people feel they're included as physicians. Absolutely. All of us are extremely competitive. We work hard to be where we're at. They need to be heard. They need to believe in the vision. Yeah. That is not it's not a vision for yourself. It's a vision for all. Unified vision. And they're all sort of will benefit from being on that bus. Yeah. So I have a partner, Dr. Zafar. He says, "You come and get on Mizani's bus." Yeah. I never understood what that term meant, and it was, we create a bus, and we basically get on it, but it's not my bus. Yeah, and everyone's going for it together. I call it a symphony. Yeah. A symphony is a group of people playing music. Yeah. And if the person who plays the jazz and person who plays the piano, a person who plays the violin, don't do their tone at the appropriate time, music is not done right.
Yeah.
So I call this a symphony, and I think you need to become a symphony orchestra, leader, and do a good job.
Well, you definitely led this orchestra well. It seems like it's good music at this point. But through this, right, did you ever get into professional education on business? Did you educate yourself on how? Because running a group this large with ups and downs of business, insurances, pandemics, all of that. I mean, I can only imagine this is a bumpy road. So
Definitely, just like you do CMEs for medical education, right? I got into the learning business very early on to understand the language of healthcare. So I did a medical executive education in Harvard, about a year program where we actually went on campus and we met with people from all over the world. You had to have 10 years of experience running a company and X amount of dollars of income to even be considered, and I was wondering why. But when I went there, I realized the level that they teach is not basics. Is about people that come with extreme complex problems and then how you solve it, right? Yeah. So we did case studies on all kinds of different industries, from Southwest Airlines to Coca-Cola and to different hospital chains across the world, different healthcare systems, Europe, US, Canada, and why they're different from each other. And we had to present, typically, I mean, there were people that, I remember this particular lady, she was from Netherlands, she ran 28 hospitals.
Oh, wow, yeah.
So group CEO, right, and insurance companies, and then it was me. I just represented a little practice from Texas, which was funny to them. But at the end of the training, you had to come up with this idea, present a project that you think is worth discussing in the class. So I presented LASO Health, which later on went on to become the app that, probably talk about it later.
Yeah, absolutely. And so I'd love to talk about that, because I know we talked about this, and it seems like it's been a project that sort of is your vision to bring healthcare to a lot of people across the country at this point. Tell me a little bit about that. Tell me how that idea came to, and then, how did you get the thing running, and how's it doing so far?
Yeah. So, remember it was like 10 o'clock at night in the emergency room, downtown Baptist, San Antonio. And I was seeing patients after patients after patients. And then, this went on obviously for years. Yeah. But this particular night, I was dealing with this patient that came in with asthma exacerbation, short of breath, and was a dialysis patient and so on. And I asked the patient, it wasn't one of my own patient, from another nephrologist, from another group, why are you in the emergency room? And she goes, I tried to get in to be seen and there was no appointments.
Okay.
And I said, but how long you been sick? And she goes, I've been sick for like a week and a half, and they couldn't get in to see their primary care doctor. It wasn't a lack of insurance. It wasn't a lack of funding. It wasn't that she wasn't connected to the system.
Just availability.
It's just availability time-wise. So it led to an emergency room visit, which actually was pretty complicated because she was extremely sick and had to go to ICU and a number of days in the ICU and so on. So patient access in the United States, whether you have health insurance or not, is a serious issue.
Oh, for sure.
Right, and the more smaller cities and less doctors or providers, even worse, right? So I know of clinics that people have to travel 100 miles to see the first doctor, right? Yeah. So I had this idea, and I was doing this education in Boston. So I presented a sort of a project to my professor and other students, which later on became LASO Health app, which is a platform, and I put a synonym to it because people understand it better. So think of it as Amazon of healthcare. Yeah. And then on it, I said, why don't we create a Netflix model where you pay a monthly premium, but you can access it as many times as you want. Yeah. Without insurance, so we don't have to deal with the healthcare insurance, across state lines, because it's highly regulated, and it is for a reason. Besides the point. Yeah. So we create a holistic platform where entrepreneurs can bring in their companies and we integrate them from a tech standpoint. And you as a customer, you have one sign-in sort of username, password, go in there, and you can access many different things, and it's free.
Okay, so
With a
besides the
monthly
membership fee, you're not paying for anything else.
You're not paying for the
That's
visit.
phenomenal.
And it's not only for you, it's for your family.
Okay, wow.
So in there, you can find the concept of teletexting. So, you're a doctor, and I'm sure your friends and family text you all the time.
Yeah, they're all
I got
getting...
this condition and that condition. What should I do? What should I take? I think I have a UTI. I think I have a lung infection. What antibiotic you recommend? So imagine that, but organized. Medical records, doctor keeping of what's happening. And now there are thousands of people, soon to be millions, hopefully, where they're on this platform, and they can access it. And in a family, for example, it's like $19.99 a month, and you can
for a family of 4.
Family of doesn't matter how many.
Oh, okay. So you're just paying $19 every month.
That's it.
Oh, wow. Yeah.
That's it. Yeah. And you can visit your doctor 25 times a minute if you want to. In fact, the response time is something that I really look at, and it's typically under 20 seconds.
Wow.
You can 24/7. You can speak to a doctor, get your medication, refills. You can do video conference. You can do laboratory review. There's the medications, when they prescribe it, you can get a discount at the pharmacy. So the idea was to create a parallel healthcare system to the one that we currently have. It is not easy to solve the current healthcare system, but if you create a parallel to it, and it's not insurance based, so it's not regulated by insurance,
solve that access problem immediately.
You immediately resolve the issue of. I mean, I see all the time. Patients don't come see you because they can't pay the copay.
Oh yeah,
these are people that have health insurance.
Absolutely.
Now imagine those that have no health insurance. Who takes care of them?
Yeah.
So I'm extremely passionate about the, believe it or not, half of the United States population that are employed don't have health insurance.
Oh yeah.
And it's because they're part-timers. And these part-timers don't qualify to get health insurance, health benefits. So they are forgotten. Portion of society, and they happen to be between 22 to 45 years old. Now you say, well, they're young. Yes, but they're in a reproductive age, and they have kids, and those kids get ear infection, bronchitis, and this and that, and what happens to them? They go to an emergency room.
Or they get sicker, and then they have to go, right? So it's just worse clinical consequences.
So what happens when they go to emergency room? Think about it. You end up with $20,000 bill,
large bills,
and you go bankrupt. Then what happens to these people? Well, they will never become innovators, entrepreneurs. They're going to stay in jobs, and all their life, they're just going to be living paycheck to paycheck. Because they had 2 or 3 emergency room visits because they had little kids.
Well, the impact of this is beyond what can be described, right? I mean, certainly. So you said it's across all the states, so it's all 50 states?
50 states.
Okay. All 50 states, it doesn't matter if you're insured or uninsured, it's a completely separate thing. You can pay a subscription, you get access to a physician within minutes, and they can write prescriptions, they can see you in a televisit if you need to be seen.
Correct.
And there's no other catches to that. There's no other fees, there's nothing else they need to pay. And that's $20 for a whole family.
For a whole family, right?
So I can't imagine a situation where anyone, doesn't matter what their insurance situation is, why wouldn't they want to have this? Like I don't get it. It's so inexpensive, and it's so convenient.
I'll tell you, we did a group, friends and family fundraising, right? We raised about $8 million, and it's if I had the funds to go and put this on CNN, Fox, and all the other U.S. channels.
It would explode.
There's no question about this, but that requires about $20 million, right? Don't have that. If you have it, let me know. I don't have that in terms of what we've done is we've invested in the product. And now we have hired someone who's pretty high up in the brokerage firms and goes and talks to large corporations. And tells them, look, we are here to take care of your employees so they stay healthy and they do their job well and take care of their families. We're interested in the groups that have no insurance,
Yeah.
which are those part-timers and half of the employees. Give them an opportunity to even buy this on their own.
Yeah.
Not that you pay for it. Let them buy it on their own.
So why not pivot to a model where a consumer could just pay by themselves? Is that harder to do?
No, it can be. If you can get the word out,
Yeah.
you can get this on TikTok and Instagrams and all that, but people see
I'll certainly do it.
there is an alternative system, right? I have not been able to get the word out to the millions, right?
It is definitely difficult, and the marketing side of this, to be able to market to people who need it is definitely challenging. But like I said, anyone who hears it, right, and you get the idea of the cost that involves, it's like $4 a person if you've got 5 family members. And that's, there's no situation where I can imagine somebody, even with insurance, walking into a medical office, so not an emergency room, and spending less than $20. Even their copay is going to exceed that, or their deductible is going to exceed that. So this is, and they don't pay anything to see the physician.
They do not pay.
Yeah, they don't, and they've got discounted medication on top of that.
Yes.
Which is better than some of the other discounts that you would find online.
You can get on the app. It's called LASO Health. Download it on App Store or Google, and basically you can play with it. Get into LASO Connect.
Yeah.
LASO Connect is really connecting the patients with the doctors.
Yeah.
And then you can go in the section of LASO Meds, right? And in the meds, you can actually pull up your medication that you're interested in.
And so all your data is in there.
It's all there.
Your previous visits, your history.
Oh
your
everything is on your phone.
And it's all HIPAA compliant communication.
Of course.
Well, that's phenomenal. And we looked at that demo while we were talking, and I saw you get on with a physician in less than a minute about a rash. And you were third on the list when you clicked, and it took them less than a minute. So I can imagine if it's a bigger issue, like somebody puts in something that sounds ominous, like my arm's not moving or I've got chest pain, it's probably even faster.
Oh, yeah.
You're triaging them even faster.
We actually time exactly how long it takes, and it took us about 20 seconds.
Yeah.
But had I put a shortness of breath as a cause of my visit, not rash, instantaneously.
Wow.
It's nothing like it in the country, right?
Yeah, it certainly is it, for sure.
We're really now, again, we've been building this, right? It's not easy to build this up. But I think this year on, the idea is all marketing. So people to hear about it, right?
Yeah.
And again, this could be useful for anyone in the country, whether you have health insurance, right? Whether you don't have health insurance. If you are an employer and want to lower the cost of healthcare for your employees, right? And if you think about it, every time a family or a patient, an employee gets sick and goes to a doctor, you create a medical claim. The medical claim at the end of the year hits the total cost of expenditure, and your employer, they look how much you paid in premium and how much you spent. If you reverse in the ratio, obviously your medical loss ratio is going to be negative and your premium goes up. So if you're an employer, you're out there and you want to do an intervention, you put this product on top of your typical health insurance coverage for your employees, and bam, you're going to have happier employees.
Yeah, I can't see a reason why one wouldn't do it. I mean, so at the moment with Health 210, we've got about 30 people that are in and out every day, right? Even within those 30 people, and we were talking about this morning, you've got somebody sick every single day. Every single day somebody's sick, or their kid's sick, right? Or something like that. So not only does it impact your bottom line at the end of the year, because your health insurance premiums can fluctuate, your productivity gets affected if people are missing, right? So if you don't have excess staff, you have enough staff to run operations effectively and efficiently. So if one's out, that means operations are in the dumpster for that day. So if you can improve that by intervening early, not only is that affecting your bottom line, it's affecting your productivity. And then the whole side of benefit that the employee gets and their family gets, the fact that they get care early, timely, good care. So these are all board certified licensed physicians who are available on a couple of clicks. I've got all my siblings are physicians. If I needed to ask my brother for a cough syrup, it probably would take him like an hour and a half to get back to me. Like I text him, then I wait, then I call him, then I call his wife, right? So even as a physician, if I need access, I mean, I've got no ways to get that in less than a minute.
I mean, that was the idea, right? And when you're an entrepreneur as you are, I walked in your office. I love seeing what you guys have done with the place.
Thank you.
I love what you're doing for us, right? I mean, you're giving us a platform to speak to the masses, right?
Absolutely.
And this is next generation of doctors, right? So you could have been at home with your family, but rather you invest in the time to create a product, right? So same for us, for LASO Health. I mean, the idea was to create a platform that people can very easily, sort of a Netflix model, price of 4 coffees a month, have a healthcare system that covers the entire family, right, and get access to medication. So seeing that becoming reality, sometimes
priceless.
I step back.
Yeah, it's priceless.
Sometimes I step back and I look, wow, I could die today. And there'll be something left behind
for
that
sure.
My father would be proud of. That,
and it's hard to make Iranian fathers proud.
Oh, yeah, they're not proud of. They're very strict. I gotta tell you a joke later, but it's going to touch what my dad used to say, is do something for society. In other words, there was his motto that you got to be beneficial to the society.
For sure.
I'm translating. I could die today, and this thing goes on. It can change the lives of millions of people.
That's beautiful.
And that's really what I'm born for.
I love it. That's phenomenal. If nothing else, you're getting a member tonight. I mean, I'm getting on this thing because I'm sick of having to call people and ask for favors. I'll pay $19, man, and no questions asked. Like, I know my kids are in school. You know, they're sick every other Thursday, right? And I mean, I can't imagine how one would pass on this. Like, this is way more valuable than Netflix in all imaginable ways. So this is beautiful. I love what you've done. The fact that you came up with the idea, and then again, running a business, having so many people that, that Mizani bus that you talked about. I mean, that's taken a lot of people.
Symphony.
Yeah, that's
orchestra.
Taken a lot of people really far. So I feel like there's impact of that. It keeps you busy. It's in there's finances to look into. Then stepping away from that and then investing into something like this, and not only, I think of 17 things and do none of them, right? Thinking of something of this magnitude and being able to actually work on it, make it happen. I mean, hats off to you. This is great work.
It's been difficult, right? Again, as I say, I constantly say falling and getting up. This has been the story of my life, right, from day one, and I still do. But once you you fall 7 times, you get up 8. You've heard that. Denzel Washington says that, and I love Denzel. It's not giving up, right? But you can have a lot of ideas and plans and things, but to execute on those and take it to where it's a final product, it takes someone who's extremely hyper focused. Right, and basically looks at plan A, B, C, D, E, and then some others. And find the right people to accompany that, him in that journey, right? Because this is not a one man job,
Certainly
right?
Isn't.
There's no Mizani bus. This is an orchestra.
And
I learned the word orchestra from my son because his college essay talks about that. You need to be an orchestra, and I was looking always for the right word. How do you describe this, right? And in orchestra, people play different music, but to make it a true music, they have to play it right tone at the right time, right? So I've been blessed. I think something or somebody up there constantly guides me in the right direction, right? And I'm not perfect by any means, right? Make a lot of mistakes. But the idea is being noble in a sense of wanting to help people. Because I was helped. Right? And here we are. But I love to have another member. So if you want to become a member, hey, come on board.
Before I sleep tonight, I'm telling you. So I have a question, right? So you've been of major influence in terms of being a physician. Patients generally, they see you on the worst day of their life, right? That's where they come in. So you make an impact at that point. Then by extension of your large group, you've touched many lives that you may not have directly influenced, but you've got a part to play in that. And with this now, you set out to hopefully one day help millions, right? I want to know, in Hamid Mizani's life, is there a person who helped him? Who's the, if you were to go back and look is there a person that stands out amongst people that have been involved in your life who are of great help or influence and sort of, got you to where you are today?
I'll tell you, there's not one person, or there are persons, because in a journey this long, I'm much older than you, the journey is got different stages. And, there's always going to be your parents, right? Mom and dad. Mom is very patient, is a very kind person. Dad is much more, let's do it, right? But guide you with the right values, right? And I don't know if I said that, but I grew up alone since age 12.
Okay.
I lived alone.
Wow.
And you don't see a lot of 12 years
How
old
did that happen?
kids. It's a whole story of its own. One day, if I'm alive, I'll tell you a story, and you'd be like, "Whoa!" It's against all odds for me to have the privilege even to be here.
Yeah.
And a country where it gives opportunity to everyone, right?
Yeah.
So I take that not as given, right? It's a privilege to be here, and it's a privilege to be a doctor. So mom and dad, my brother is really someone who grabbed me at age 12, and he was himself 26 years old and barely starting his life, but helped me with, education, expense, love, and nurture me. But then I met so many friends and people along the way that without one of them in this journey, this would not be the outcome.
Complete,
And I don't know who lined them up, right? Because it wasn't me for sure.
Oh yeah.
I had no idea, but the story is a 12-year-old kid.
Yeah.
If you grab your 12-year-old kid right now and you send him away, and don't know where they've gone, did they eat today? Did they live? Did they die? Did they get sick?
Can't imagine.
You cannot have an outcome that we have today, and it wasn't me. So I'm a true believer of a God and Supreme Being up there that does things to different people, and to me, it protected me. It lifted me up. Obviously, my family, my wife, my kids, friends have been an enormous source of resource for me.
Yeah.
People that for no reason helped me to be where I'm at, right? And I don't want this to sound like Oscar. People go,
I get
an Oscar, and I'm forgetting that this and that. There's so many people.
No, I get it absolutely. So we do this thing where we ask you some questions. These are light questions, and it's like a rapid fire round. So you shoot and answer as quickly as possible.
Yeah.
Okay. So my first question is, what's the first thing you check in the morning when you wake up? Is it labs, emails, or the stock market?
Emails.
Emails. That's an unusual answer for a nephrologist. You're probably bothered by potassium. Oh, I guess you wake up in the middle of the night to look at the potassium.
I wake up 4 a.m.
Yep. All right, let's see. So second question is, what's harder, rounds or board meetings?
Board meetings.
Board meetings?
100%.
Why is that?
I love rounding on patients.
Okay.
That's where my relaxation is, seeing patients.
Love that answer. Let's see. Third one is, one business lesson medical school did not teach you.
The business of medicine, so to speak. Understanding that what is billing?
Yeah.
What is collection? What is coding? I have no idea what any of that is.
Love it.
I knew how to treat hypokalemia, kidney transplant failure, dialysis. I had no idea day one opening the practice. I had to do billing.
Yeah.
What is that?
Yeah, for sure. No, as I was writing this question, I was like, he's going to say no business lessons in med school. Med school was all about anatomy. No, I get that. I get that pain point for sure. So, if you weren't a doctor, what would you be?
Pilot.
Pilot?
Yeah.
Oh, why is that?
So, I'm a pilot.
Oh, you're okay. You find
when you go up in the sky and you look down on the clouds and this blue sky, and everything down below is just little, right?
Wow.
And there's incredible amount of silence and peace.
Yeah.
Something that sometimes you don't get on Earth, right?
Oh yeah.
So I always wanted to be a pilot.
Yeah.
But obviously that was not on the list of things you do for your father.
it's meditative for you, and of course you've got a Irani father, right? So you've got to take care of that. So, last question. Do you trust your instincts more as a CEO or as a physician?
That's a great question.
Mm-hmm. I know I wrote it.
it's a great question. As a doctor. I treat my instinct.
That's humbling to hear, though. For someone
Yes.
who's got a large business like
Yeah.
you and is involved in so many things.
Yeah, your instinct in business is not 100% correct. You
Yeah.
have to look at data.
Yeah.
I've done nephrology for 20 plus years now, and I look at a patient, I can figure out what is wrong with that patient typically about 80% of the time with lab data.
Yeah.
I need to see blood work, right? In business, no, because actually that is not my field. I'm
Yeah.
a doctor by training.
Yeah.
I've had proper training for many, many years to be a doctor, right? And I love it and I care for it. I happen to learn business.
Yeah.
So it's my second career, right? And as a second career, you need to be smart enough to know you don't know everything.
Yep. Absolutely.
Right? And you need other people's help and data and analysis. And typically, it kind of, as years go by, they kind of get close to your instinct, but not entirely.
No, I love that answer. That's awesome. Dr. Mizani, tell me a little bit about the scope of your group's interventions and practices.
Right. So, South Texas Renal Care Group is a medical practice that I founded 21 years ago. And it's basically everything that there is to do about kidney disease, right? So we take care of patients in offices, and we have about 14 offices throughout the city. It goes all the way from U.S.-Mexico border, from Eagle Pass, all the way to Hondo, Lytle, Bernie, entire San Antonio, all the way in Schertz near Austin. And we also have 20 plus nephrologists that are throughout the hospitals. So any type of ICU interventions or care, consults in the hospitals, we're there. From chronic kidney disease, acute kidney failure, diabetic kidneys. We take care of a lot of lupus patient, rheumatological conditions, and we also do a lot of kidney transplants. So we're part of one of the largest transplant centers in America. And we have probably also about 15 dialysis centers throughout the city.
All right.
So one of the biggest home dialysis programs in the state is ours, and this basically is for patients that do what's called peritoneal dialysis.
Yes.
And we can teach the patient to do their own dialysis in their own home. But what's interesting is that we also have a pretty large population of patients that they do their own hemodialysis in their own home.
Okay.
And it's a very interesting machine. It's called Tableau. It's like, think of it like an iPhone versus the flip-flop phone back in the day.
Yeah.
This machine is very intuitive. It talks to the patient as they're going through the treatment. So a lot of people that work and they want to do their dialysis treatment in their own house at the time that they want, we'll train them to do it. Wow. And then we have central systems that monitor the dialysis session, how it's doing, and so on. Then in the different offices, we have everything from patient education, consults with dietitians, social workers, of course, doctors. We have nurse practitioners, extenders of caregivers. And then we have something that is very unique in San Antonio, which is we have a division of vascular surgery. Phenomenal. And the reason for that is a lot of our dialysis patients deal with issues related to their fistulas. Yeah. There's a connection in the arm to be able to do dialysis. And over the years, we realized if we want to improve the quality of care under one roof, we needed to have a division of vascular surgery. And, we have 3 vascular surgeons, soon to add more. Love it. And we have our own surgery center. So a patient that needs vascular access can get the surgery as an outpatient and basically go downstairs to dialysis and do the treatment and go home.
Wow.
One place, basically, one building does all of that. And that's one of the reasons that we actually became a part of a organization with Medicare. It's called Chronic Disease Management, CKCC. And that is a program where it's highly, highly focused on quality of care and cost of care.
Yes.
Both together. And in other words, it's creating a paradigm in nephrology where you do the right thing for the patient. So it's not based on fee-for-service model where you see a patient and there's billing. No, this is a sort of an entire program where we work with Medicare directly and then provide good service for the patient and so on and so forth. So it's very, very quality of care oriented. And I'm very, as you know, I'm very passionate about that.
No, absolutely.
And that program is growing tremendously. And there's probably about, in San Antonio, we're the only group doing what's called value-based care.
Yes.
Right? The other renal groups don't have it.
Yes.
And in the whole country, there might be 30, 35 practices that do this. And there are other insurances now that are getting interested to talk to us about quality of care and so on.
And so because it doesn't only save insurance money, it's basically better care for the patient, it's more timely care. And I believe only groups that are of this scale, can even dream to offer something like that. Because having physicians all across, from coast to coast, dealing with every single imaginable issue that can be with the kidneys, even the absence of working kidneys, right, with dialysis and all of that, and then the transplant program. So that's that's phenomenal.
Yeah, this is highly focused on quality of care, right? And there's no overutilization.
Yeah.
And that is one of the things in healthcare. We always like to say healthcare is broken, but we have to critique it, right?
Yeah.
Good and bad. There are some places where there is overutilization of healthcare dollars, and we don't do that. We want to avoid that. We want to do right by the patient.
Yeah.
Where they get the care that they need.
Yeah.
We lower hospitalizations. In other words, we manage them significantly as an outpatient.
So you're optimizing cost as well.
Optimizing. So, so the patient is not in the hospital.
Yeah.
It's good for the patient. They're at home.
Love it.
Or they're working. And it's better for the healthcare system, right?
Absolutely.
As a country, you look to see where is the happy medium.
Yeah.
And so we just got recognized by Medicare, and this is public data, that we were on the top 1/3 best performer in the country.
Wow.
For that service.
Yeah,
right?
that's phenomenal. Love it. So we know where to find you, right? But if somebody wants to see you, where's your office? Where do you primarily practice?
So you can get on texaskidneycare.com and all the offices are listed there. But my office is in downtown San Antonio.
Okay, perfect.
And right across Christus Children's Hospital.
Excellent.
That's 215 San Saba.
Perfect.
If you leave my car, if I turn on my car in the morning, the first thing it tells me, you are this many minutes away from your office.
Yeah, well, you do that long enough. Google Maps know. Yeah. So I want to thank you because I know you were working, you're really busy, and you had to drive 40 minutes to come and see us. But I can tell you this was, beyond enjoyable for me. I really love talking to you, and I think it gives us perspective. We're really young, in this business. We've only been doing this for a few years. So listening, people who've done this for more than a couple of decades and done this well and have had patient care at the center of all of this is always delightful. So thank you so much for your time, and hopefully we sit down again.
Thank you for giving me the platform and the opportunity to come see you guys. I'm extremely proud of you guys to see what you've done.
Thank you.
Because many times the norm is you don't see entrepreneur physicians where they open their office and they create that patient-physician relationship, which is the reason why we got in this. And they end up working for an insurance company or a hospital because it's easier, right? So kudos to you guys. Thank you so much.
Thank you so much.